I'm Dave Casper. Our guest today is Dr. Paresh Patel, general dentist in private practice in North Carolina. Paresh, thanks for being here today.
Absolutely. Glad to be here.
Good to see you.
Absolutely.
I wanted to take a few minutes and chat about your very first implant case.
Okay.
As a general dentist doing implants, there had to be either a patient or an experience that pushed you over the edge. You finally said, I have to jump in. So tell us a little bit about who that patient was and why they were the first, and how did it go?
Sure. So, I always was scared of the aesthetic zone. What if I put the implant in? What if the gum tissue didn't heal right? What if the implant had to be removed? What if I did a multitude of things wrong? Was there going to be a recovery that was worse than if I just left the area alone to begin with? As a general dentist, I was always fearful of this, nerve down here, this big rubber band. And before you actually see it for the first time, you have in your mind that it's this big scary thing. But when you see it for the first time, it's actually bigger than you imagine. So once I actually saw the mental foramen, I was like, okay, so this is what I was scared about the whole time.
Not a big deal.
It's not a big deal. So my first patient that we did an implant on was sort of in the maxillary arch, which is probably backwards of what we mostly see. Is usually a molar down here, around number 19 or number 30.
Right.
But in my mind, I was scared of the aesthetic zone here, I was scared of the sinus, and I was also scared of the mental foramen or the mental nerve. So this number 13 was my very first implant. It was far enough away that I felt like I could have the leeway that it didn't turn out exactly perfect. It'd be outside the patient's smile line, and I didn't have to worry about this sinus, which was also scary to me when I was first placing implants. So that's how I picked it, and she was a very good patient. I had come through hygiene multiple times and was wearing a flipper for one missing tooth.
Really?
So I really felt bad for her, and I said, let's consider doing an implant here for you. If you're willing to take that step with me, I want to provide that service for you. And that's how we stepped into our first implant.
That's fantastic. So did you get any sleep the night before? How did you prepare? What was that like?
So that day, we canceled all the patients that day, canceled hygiene. It was one of those things that was a big production for us. So we made sure we had 3 or 4 different diameters of implants. We had 3 or 4 different lengths. We had everything that we possibly need. We laid everything out on the table. So it was just her, me, and the assistant and the front office staff. So we got in there and we did it, and it really took all of like 40 minutes, and we wondered why we were taking the whole day off to do this. But I think better to be cautious and feel good about what you're doing and offer the patient every chance of success.
You bet. And that patient, she was happy?
Oh yeah, we put the implant in. In retrospect, I probably would have done what I normally do now, which is either to go ahead and put a temporary cylinder on and get some sort of temporary crown on there to help preserve that gum tissue and start to mold it in the direction we want to, or at a minimum not use a stock flat healing cap, but actually put something in there that will preserve that the dimension of the root the way that I want it to.
After the first time, you're just happy to be through it.
That's right. So I think it's always nice to use a 2-piece where you can separate the prosthetic phase from the surgical phase. If you're first starting, you can just put the implant in place and stop and take a breather and decide, do I want to continue or do I want to just stop and bring the patient back?
That's great. And so with the confidence gained after that first case, how long before you tackled number 2, the second case?
It was not very much longer after that. I think if we had another patient that day, we would have gone ahead and put him in the chair because we were.
The schedule was open.
The schedule was open, and the excitement level was there. And the thing that I really see that I'm disappointed in dentists not investing in their staff. I would encourage every dentist that whatever course they take is to bring at least the clinical staff with them, their main assistant, or at least the front office manager that needs to understand the concepts of how to schedule for this. The last thing we want to do is have the dentist come in who's maybe not done their first implant and get the surgical kit and then ask the assistant, please hand me the lance spur or the Lindemann drill, or they have no idea, or hand me the hex driver, and they're looking in the kit, and then you have to point it out to the assistant. So if the assistant can go, it's almost one more set of eyes and ears to sit through the seminar, and then if you forget a step, she could say, doctor, don't you need this next?
Right.
And I'm guilty of that because my assistant is what makes me great. She's the one that helps keep me in the right direction 90% of the time because it is sometimes a little mind-boggling the amount of things that you try to manage in one appointment.
Yeah, well, we're glad you jumped in and we're glad you stayed in.
Okay, well, thank you.
Thanks for sharing your story.
All right, yep.
Yeah.